Welcome, everyone. My name is Liz Bryant, and I direct the North Idaho Area Health Education Center, or AHEC, in Moscow, Idaho. I am so pleased to welcome you to today's session, Increasing Resilience and Well-Being, a Virtual Training for Healthcare Professionals. Our speaker today is Dr. Laurel Holyoke. Dr. Holyoke earned a PhD in Leadership Studies from Gonzaga University and is currently an Associate Professor of Adult Organizational Learning and Leadership at the University of Idaho in Moscow, Idaho. Dr. Holyoke teaches, researches, and practices profound living and organizational health and is a certified international mindfulness facilitator at the professional level. We would like to thank the sponsors of today's session: Southwest Idaho AHEC, North Idaho AHEC, Southeast Idaho AHEC, and the WWAMI Medical Education Program at the University of Idaho. With a shared focus on the development of the health professions workforce in rural and underserved communities, we are thrilled that over 300 participants registered for this event, representing a broad range of health professions throughout the Pacific Northwest. From physicians and nurses to dentists, social workers, and community health workers, thank you for investing the time to attend this session. And without further ado, I will turn the floor, or rather the screen, over to our presenter, Dr. Holyoke.
Thank you, Liz. And thank you for the introduction. I appreciate that. And thank you to AHEC for sponsoring me and WWAMI, but also an additional thank you to Liz, because I know that she has been working behind the scenes, and Leslie, to make sure that this goes off okay today. And welcome. I'm so glad that you're here. I'm so glad that so many of you signed up to be here. And I hope that the next hour you will find invigorating and fun. But before I get started, I just want to take a moment of pause for everybody to settle in, to arrive here in this moment, and ask yourself, why are you here? What motivated you to sign up for the webinar? Is it something that you would like to get professionally or perhaps personally? Are you filling a need, or do you have a need that needs to be filled? Or did you just want to take a break? Maybe you're eating your lunch. Please continue to do that. I won't be eating mine. So whatever it is that you're hoping to get, I hope that I'm able to deliver that, and just welcome. On our agenda today, the things that I plan on covering, I'm going to talk about compassion fatigue. As we all know, it's very close to healthcare professionals. I'm going to talk about mindfulness and what mindfulness is about and the practice of mindfulness. We're going to cover the 3 components of self-compassion as introduced and researched from Kristin Neff. I'm going to share some techniques to increase resilience, self-compassion, and well-being. And I'm going to talk about the research that's related to resilience and self-compassion. So I'm going to normalize a couple things here for healthcare professionals. I'm probably talking to the choir or preaching to the choir in the next couple of slides, but I just wanted to cover this. The research tells me that 40 to 60% of healthcare professionals are challenged by burnout sometime during their career. We're going to learn that that's much different during these times of COVID-19. Healthcare professionals are especially vulnerable. Their jobs require considerable emotional and physical investment, that they are put in a disadvantaged of an imbalance due to what's required both physically and emotionally. We face excessive exposure to adverse events that cause secondary traumatic stress. And things that are exacerbated by often limited resources, such as time that we're allocated to give per patient or per client. And some important considerations, or again, some more information for the choir. that the phenomenon of burnout across healthcare professions is a national concern. There's some consensus that burnout is a response to the prolonged exposure to demanding interpersonal circumstances. And again, during COVID-19, these are all heightened quite a bit. Work-related stress is pervasive across all healthcare professions. The research shows, this is recent research out of China and out of the United Kingdom, that 50% of healthcare professionals report deteriorating mental health since just the beginning of COVID-19. And to boot, it's not just frontline healthcare professionals. It's people that work alongside you that maybe don't handle patients or don't handle clients, but this affects people that are in the back office. So the consequences of healthcare profession burnout are pretty darn serious. They include, and these are not often addressed, I might add, and it's not very much in the media, and it's not talked about in our workplaces as well. So the consequences end up with patient satisfaction and provider empathy being severely reduced, and increases medical errors and patient safety concerns. And the stress and burnout contribute to lower productivity, lower retention rates, and higher absenteeism. So this is where I want to talk about compassion fatigue. It's also a lesser known healthcare profession occupational hazard. But this concept refers to the emotional and physical exhaustion that can affect helping professionals over time. It's been associated with a gradual desensitization to patient stories or what clients tell us, and oftentimes described by patients as poor bedside manners, when we have nothing left to give. That helping professionals have also found that their empathy and ability to connect with loved ones, so this is outside of work, and their friends is also impacted by compassion fatigue. When we don't have anything to give in our work, we also don't have a lot to give in our personal life. So compassion fatigue is also called the cost of caring for others that are in emotional pain or who are in emotional pain. It's profound emotional and physical erosion that takes place when healthcare professionals are unable to refuel and regenerate. We can think of compassion as a state of reduced capacity. We can think of compassion for fatigue as a state of reduced capacity for compassion as a consequence of being exhausted from dealing with suffering of others. It's associated with burnout and secondary traumatic stress. So there's only so much that somebody can give when we're helping others if we're not helping ourselves. And the problem is, without capacity flowing back in, eventually you run yourself ragged. And you also identify too closely with those people that you're working with, those people that are suffering, and start to take on the burden of their suffering without being able to get away from or out from under that. And one sad part is an insidious way that the process is accelerated is when people have chosen to go into care professions, into healthcare professions that require a lot of compassion and care for others, when really they're trying to heal themselves. So this is, these are people who may have had a traumatic childhood that then think that they want, that then try to go back, and this is oftentimes very unconscious, to go back into helping young children in order to heal their own wounds. And yet, oftentimes that doesn't work, and it leads to compassion fatigue even faster. What I think is alarming, it's not just physical health. It's way beyond personal protective equipment, or PPE. It's beyond the physical limits that we're talking about. We need to talk about mental health, because I think we have a probable mental health crisis that's facing healthcare professionals resulting from this pandemic. I think that crisis has been moving forward anyway, and I think during this time, it's been accelerated, accentuated. And we have, right now, healthcare professionals are being lauded. Thank you so much for being on the front lines. And a lot of what we're talking about includes the physicalness of what they're doing. However, we're not paying attention to the emotional baggage that's going along with it, to that fatigue of caring. And it's not just caring for our patients or our clients or the people that we work with. It's also caring and worrying about our family. If we're going to come back and expose our family to COVID-19, that we don't just leave things at the door, or we don't leave them in our, when we walk away from our desk now that we're working from home, for those of you that are working from home. This happens when our calm surface appearance is the only armor we have left. So it's very thin, and what looks like on the surface that we have things under control, that may be the only piece of armor that we have left. So in a very recent medical journal, JAMA, that did research in China, that they surveyed 1,200 frontline healthcare workers. They found that 50% reported symptoms of depression, 44% had symptoms of anxiety, 34% had insomnia, sorry, that was a hard word for me to say, and then 71% reported just distress about their job. So let's talk about research on mindfulness-based interventions, and this is specifically for healthcare professionals. A recent meta review on other research studies, so they looked at 81 different research studies that had a total of 3,805 participants. So many of these studies were smaller studies. And here's what they found. They found that learning and practicing self-compassion and self-care skills reduces burnout and reduces compassion fatigue. And it can also reduce mental health issues and enhance well-being. So additional evidence also suggests that self-compassion and mindfulness can enhance patient outcomes and patient satisfaction by improving interpersonal interactions. I loved this when I found this. Mother Teresa believed it was mandatory for her nuns to take an entire year off from their duties to heal from the effects of their caregiving work. She understood the seriousness of compassion fatigue. Research also indicates, and this is more general research, not just research that's pointed towards healthcare professionals. They found that self-compassion increases life satisfaction, optimism, our social connectedness, both at work as well as in our family and our friends. It increases happiness as well, which many of us shoot for. It helps build resilience. And again, when you learn and practice self-compassion, the resilience just doesn't get placed in one area of our life. It's a balance, professional and personal. And it improves emotional intelligence, it improves wisdom, and it improves well-being. So overall, self-compassion strengthens one's psychological profile, helps build us. But I want to come back and look at, okay, so what does compassion fatigue look like? How do we know when we see it or maybe start to experience it? Again, it's giving more compassion than you really have to give. There's only so much energy that each one of us has to help others without first helping ourselves. So when we're not helping ourselves, this is what starts to happen and what compassion fatigue looks like. It looks like increased cynicism while we're at work. It's feeling burdened by the suffering of others. It's being angry and irritability both at work and at home. Sheer exhaustion, not ever able to get enough rest or sleep or time away, what it feels like time away, or to be able to get out from under what feels like this huge compassion burden. It could look like bottling up emotions and not talking to anybody, but isolating. It can also come out through increased unhealthy behaviors. Eating more, perhaps abusing alcohol, recreational drugs, sometimes also known as escapisms. Looks like sometimes just a loss of pleasure in living our lives, that what we really enjoyed before. Could involve also difficulty concentrating, the dread of working with certain clients or patients, or for that matter, the dread of working with specific individuals in our workplace, and insomnia, not being able to sleep no matter what you do. You have too much on your mind. So the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk on water without getting wet. If you are feeling these kinds of feelings or having signs of compassion fatigue, it's pretty normal and you're not alone. There's a lot of people that are joining you. And it's also really important that we keep in mind that you can't pour from an empty cup. You have to take care of yourself first. And self-care is not a luxury. Self-care is actually a responsibility. And it's your responsibility because nobody else is going to take care of you. So one way to do this, to help take care of yourself, is through the practice of mindfulness. And mindfulness is a practice. People don't ever reach perfection, and which is one of the reasons why it's called a practice, and that it's practiced daily, and it includes 3 different elements. It includes being present, to be aware in every moment. So to not just, for your mind not to be thinking ahead or not to be ruminating behind you or not to be thinking about something that's causing you suffering, but to know that mindfulness is a practice of living in the moment and being with what is right now and without judgment. So I often call this a triangle of having the intention to pay attention in an open and curious way. What is going on? and to be with what is going on, that we can take care of ourselves through practice. It sounds so very simple. However, it's not easy to practice mindfulness because this is what our active minds do. One of the guys says, "What the hell is that?" And the other one says, "Oh, just my mind." Imagine if we could see what's going on in people's minds at any given time. There are reasons why maybe we're not present, or we've got a lot of stuff going on in our minds. Our minds are very active, which makes being aware in the present moment without judging kind of hard to do. Here's what our minds do. They're a little crazy. So we engage in mindlessness. And this is the idea that a stimulus happens and we respond without thinking things through. It often looks like something that gets us emotionally, and we have a knee-jerk reaction. We don't think about our reaction. It's pretty mindless, and it can hurt others. And oftentimes we may look back on something like that and say, "Oh my gosh, I feel awful. This is not what or how I wanted to react." Our minds are very distractible. I just got a puppy 5 days ago now, and she is 7.5 weeks old. And our minds are oftentimes like little puppies because we've allowed them to do whatever they want to do, especially when we're not maybe working or focused on something. But mindfulness can bring us back to that present moment. And it's kind of like training our minds kind of end up being like puppies. So that we're doing puppy training. I know that kind of sounds silly, but I think about that every time I look at Juno is the new puppy's name. Every time she changes from one thing to another, that she sees the other dog come through and thinks, "Oh my gosh, I want to go do what he's doing." It doesn't matter what she's doing at the moment. Her mind, her attention gets turned. And the third thing that our minds do quite often is just go on autopilot. These are daily routines that we do all the time. We don't think about them because we've practiced them so much and done them. And autopilot also gets us in trouble because my son just started middle school this year, and the route to drive him to middle school is the same route that I always took to drive him to elementary school. However, when I was on autopilot, I would turn to drop him off at the elementary school and not go straight to go to the middle school. So it tells me that my attention was someplace else, and I was just on autopilot, doing something that I always do. So let's turn and talk about resilience for a couple minutes and what resilience is. Resilience is bounce back. So bouncing back is what we do when we face disappointment, defeat, and failure. But instead of wallowing or letting things keep us down, we get back up and continue our lives. So it's this process that we learn and adapt to. How well a person adapts to life events. And it's usually how well a person adapts to life events that are not a lot of fun or that are negative. It's having the psychological strength to cope with stress and hardship. It's important to know that everybody has resilience. It's just a question of how much and how well you put it to good use in your life. So resilience doesn't mean that the person doesn't feel the intensity of the event or the problem. Instead, it just means that they found a pretty good way of dealing with it more quickly than others, that they're bouncing back more quickly. They're learning how to do that. To be resilient is having a stronger bounce back. I enjoyed this quote from Elizabeth Edwards, that resilience is accepting your new reality, even if it's less good than the one that you had before. You can fight it. You can do nothing but scream about what you've lost, or you can accept that and try to put together something that's good. I often think about resilience as also being acceptance, and some of the things that we fight against, that the weather is a perfect thing to practice our acceptance on. We can not like the weather because it wasn't as good as it was yesterday and we had planned something fun outdoors today. We can fight it, but Mother Nature really is not going to change her mind about it. We can scream, we can get mad at others, and in the long run, we just really have to accept what it is. Things happen in our life, and I don't always like the word accept, but I appreciate the words just to let it be. If we can just let it be and not waste energy on it. So how do we build mental resilience and through mindfulness? So it's the idea of creating space that I'm going to talk about a technique to come down from the worried mind and back into the present moment. This technique is called the STOP technique. It's actually an acronym, right? Because we like acronyms. So the S is simply in STOP. It is to stop what you're doing. The T is to take a breath, and I say or two. And what's really important if you're practicing this technique is to feel your breath, and maybe to count to 2 or 3 as you breathe in, and count to 2 or 3 as you breathe out, but to know and feel that you're taking a breath. So if there's a stimulus, this is what you want to practice, is this technique, to stop before you react, to take a breath and feel yourself taking the breath, and then just observe your experience just as it is. You're just letting your experience be. You can notice that your thoughts are probably not facts, and they're not permanent. They oftentimes change dramatically as time goes on. And if you notice a thought, you can always name it: anger, envy, happiness, or it's usually not that we want to stop. And then also observe and notice your body. What's going on in your body? What sort of sensations are you having? Is it a burning sensation? Is it a blocking sensation? Sometimes I feel like I get blocked right across my throat, and it's usually because I want to say something and I can't find the correct words to do that. And then the final is to proceed with something that will support you in the moment. It's really easy to do, to think about. The hard part is catching yourself after the stimulus and before you respond in a way that you don't care to respond. So a short story. This was a couple years ago, I was on my way to give a presentation about mindfulness, and I needed to stop by my office and print out parts of the presentation. I couldn't find a parking spot that my parking sticker worked in, so I put in money for the meter, like for 20 minutes, because I needed to print 9 pages. I thought I'd run in, I'd be back out in plenty of time. Well, my computer decided that it didn't want to talk with a printer, and by the time I got technical help and got my pages printed, I got back out and I had a parking ticket, and I was so angry. Like, didn't that person know that I wasn't going to take that long? And I think parking ticket people are probably better trained than anybody else. So what did I do? I jumped into my vehicle and I started storming out of the parking lot. And I was driving through the parking lot a little crazy. And right as I was pulling out of the parking lot, I stopped myself and went, oh boy, wow, like mindfulness is really easy to practice when things are going well. And this is that I just got nailed with this stimulus, a parking ticket that literally I'd received it like 3 minutes earlier. The person probably ran away when I came out if they saw me. But I took that breath. I noticed I was shaken. I was scared that I was going to miss. I don't know what I was scared of, but I could feel it in my body and I could feel my anger in my body. And it allowed me to observe that. And then by the time I pulled out, and I also reminded myself, I am going to give a presentation right now about mindfulness. And if, this is my practice, this is the practice right here. So let's move on to compassion. And compassion really or literally means to suffer together, to suffer with someone else. And compassion is broken down into 3 components. The first one is recognizing suffering in another person. I call this seeing. The second component is feeling moved and emotionally connecting to that person. So we have seeing them, feeling what's going on with them, and then responding. So acting or the motivation to alleviate somebody else's suffering. So cynics may dismiss compassion as something that's touchy-feely and warm and fuzzy or even irrational. But scientists have started to map the biological basis of compassion, and they have found that when we feel compassion, our heart rate slows down, we secrete the bonding hormone, oxytocin, and regions of the brain are linked to calm down. So it's not just something that's touchy-feely. Here we are in COVID-19 that we need to physically distance ourselves. But how do we do that without emotionally distancing and perhaps practicing compassion? How do we stay connected? Well, I want to walk us through an exercise that's called Just Like Me. So wherever you're sitting, to again check in and make sure that you're comfortable. And I want you to think about a person that maybe you work with or maybe you encounter quite a bit that perhaps irritates you. Perhaps you would like that person to transfer someplace else into a different job that just gets under your skin for whatever reason. Think about that person. Bring that person to mind. And at the same time, I want you to bring a very close friend to mind, somebody that you deeply love and care for. So you're holding 2 different people with your attention, and listen and think about these statements as I read them. So just like me, these individuals want to be happy. And just like me, these individuals want to be safe, strong, and healthy. Just like me, these individuals wish to be loved and to love freely. Just like me, these individuals long for connection and friendship. Just like me, these individuals have bodies that at times feel pain, stress, illness, and aging. Just like me, these individuals have in their lifetime felt lost, felt sad, felt hurt, felt angry. And just like me, these individuals have at times felt unworthy or inadequate. Just like me, these individuals have experienced uncertainty and failure. Just like me, these individuals at times need understanding, acceptance, and kindness. Just like me, These individuals have been hurt by others. Just like me, these individuals worry. Just like me, these individuals are learning about life. And just like me, these individuals want to be content with what life is given. And finally, just like me, these individuals wish to be free from pain and suffering. We are all so much more alike than we are different. And extending compassion it can be as simple as putting ourselves in the same boat as another individual. One of my favorite quotes is, "Be kind, for we have no idea of the battles that each person is fighting." Be kind. For everyone you meet, for every person you meet is fighting a battle that you know nothing about. Just like when they meet you, you are fighting battles that you don't tell other people about. Okay, well, what about me? You can ask. So we've talked about compassion for others, and gone through just like me. Well, what about me? So consider this, that our heart has to pump blood to itself first before it can circulate it around the body. A reminder to be gentle with yourself, and a reminder that you are doing the best that you can with what you have in your circumstances at any given moment, in every moment. And to also make sure that your worst enemy is not living between your own two ears. So think about our self-talk. To think about, okay, so here's some non-helpful self-talk. You are such an idiot. Oh my gosh, why did you do that? You should have known better. Yeah, right. Like I could ever be that lucky. She was never gonna go out with me anyway. I'm just too ugly. I'm not good enough. Whatever made you think that he liked you in the first place. So this is where I want to talk about self-compassion. And self-compassion, I think the guru, the person who has studied it the most, has been Kristin Neff. So I take these three components and break them down for you based on what she has taught and researched. So the first component is self-kindness. I'm going to unpack these in a minute. I'm just going to introduce them right now. And the second is common humanity. And the third is mindfulness. So learning to practice self-compassion and recognizing that everyone suffers can be a much gentler and more effective road for us to heal ourselves and to move on in our lives. So self-kindness over what many of us do, self-judgment. So extending kindness and understanding to ourselves rather than criticizing or harshly judging ourselves. It entails being warm and understanding when we suffer, when we fail, when we feel inadequate, rather than ignoring our pain with self-criticism. And to think about it this way, if you wouldn't say it to a friend, why in the world would you say it to yourself? That self-compassionate people recognize that being imperfect, failing, and experience life difficulties is inevitable. So they tend to be more gentle with themselves. They tend to practice self-kindness over judging themselves. Imagine this. If we obsessed about the things we loved about ourselves. The second element of self-compassion is common humanity. Common humanity is the idea that making mistakes is intrinsically human. It's a normal part of life. And common humanity versus isolation. So oftentimes when we do something where we fail or don't do as well as we'd like to, or it's we're struggling, we often feel alone, like we're the only ones that's going through this right now. But common humanity tells us that that's not true. So it's understanding that we're not alone in our mistakes, in our weaknesses or failures. So welcome to humanhood, right? Common humanity during COVID-19 is an anecdote to the loneliness that may come also with social distancing, or if we're distancing from family. And it's important to recall that we're not alone. We're not alone doing this. We're not alone social distancing, but many others are doing it at the same time. So the third element of self-compassion is practicing mindfulness, because what mindfulness does here, it helps us disentangle from what is really bothering us. So it's the willingness to observe our negative thoughts and emotions with openness, with clarity, so that they are held in mindful awareness. It's non-judgmental, a receptive state. So we're being open and aware. We're letting things be. We're observing life as it is, without judging ourselves and without over-identifying with what's going on at the present moment. So we don't over-identify with our thoughts and feelings, and we don't get caught up with negative reactivity as we're feeling these. I've shown this slide before, and I wanted to share with you that the slide in the middle is actually a friend and I. That's a picture of us out climbing in Frenchman Coulee in Vantage, Washington. So I like to share it. Think about it this way. Self-compassion is simply giving the same kindness to ourselves that we would give to others. So confronting our own suffering, looking at that compassion fatigue with an attitude of warmth and kindness without judging about what we're going through right now. So I want to pose a challenge to you again, if you would join me in this. And think of a friend, a dear friend that recently who has gone through a really difficult time. So take yourself back to when that person shared with you, or you learned about what that person was going through. And recall how you showed up for your friend. Did you listen to your friend? Did you give your friend a hug? Did you reassure your friend that, oh my gosh, what you're going through is really hard and I'm here? And I feel for you. Perhaps it was just your quality of listening to your friend. That knowing that suffering is a part of life, and what you can do in that moment is to be there. Now, think of a time that's pretty recent in your life that you have gone through a somewhat difficult experience. It may be a smaller, difficult experience. It may be something that was much bigger that happened. It could be something that you're still struggling with, or that you go back to again and again to rethink it. So without any judgment, bring this same kind of reflection that you had with your friend who is having difficulties to yourself. Like, how have you been treating yourself? How did you treat yourself? What did your self-talk sound like? Did you ignore any needs that perhaps you had during that time? So as you compare the two scenarios with a friend and with yourself, is there a difference? For almost all of us, there's a stark difference, because we would never say to a friend, a dear one, a loved one, somebody that we care deeply for, we would never say to them how we often talk to ourselves. So what we can do, however, is practice the self-compassion. We can practice reminding ourselves of the common humanity, that other people go through this. In fact, we just thought about a friend who has gone through a difficult time and how we were there for them. We probably, I like to think of the example of a baby, you know, it's an almost toddler who's learning how to walk. Inevitably, we all fall down. We see these small humans trying to learn how to walk. And imagine if, when they fell down, they just said, oh my gosh, give it up. Like, you're never going to be able to walk. Forget it, not doing this, right? They don't do that. They probably have more self-compassion. But when we fall down, when we first learn how to walk, let's go with that. Oftentimes we say, no, I can't do this. It's not for me. I'm awful at it. We forget, right, that we've been practicing walking for so long. So we wouldn't say that to a small human. So let's not say it to ourselves. And even part of practicing self-compassion, that kindness, is self-touch. You can put your hand across your heart, say, it's okay. It's okay, sweetheart. Like, I'm here with you, and I'm feeling with you. The kindness, the common humanity, to remember that we're not alone in our suffering, and then to be mindful, to not over-identify with what's going on. And to remember that most of the time when we are practicing compassion for others, a lot of times we don't know what to say. So our presence is really the most important thing anyway. That most of the time we don't need to say anything. We need to be there and acknowledge their pain, their hurt, to sit next to them, perhaps to give them a hug, and to just listen to what they need to talk through. So unlike self-criticism, which asks if you're good enough, self-compassion asks, what's good for you? What's good for me right now? And it's a perfectly okay question to ask. And one of my favorite, so I embrace this word fully, is flossom. So flossom is an individual who embraces their flaws and knows that they're awesome regardless. Think about what you do on a daily basis, and not just at work, but what you bring to humankind, and embrace your flossomness. That is what I have for you today. I'm so appreciative that you're here, and we have time for questions. So Liz, I believe, is going to help field questions.
Yes, so if you have questions, go ahead and enter them in the question and answer box at the bottom of your screen. and you can read through other questions that have been posted, and you can upvote them. So if you post those in the Q&A, and Dr. Holyoke, it looks like we do have one question. What advice do you have for mental health providers who are part of medical facilities that are also providing support to the frontline staff, e.g. boundaries?
Wow. So my advice would be to first to take care of yourself. I think, you know, what I want to see in my leaders is for them to model and help show me. And also another thing that my advice that I would give is to separate persons from actions. So to separate, if somebody comes to you, that separate, you know, what you appreciate about them, that just like me, from their actions or what they're asking about. And the practicing of non-judgment also is so important, not just on ourselves, but not judging others either. Again, everybody has a battle they're fighting that we know nothing about.
Thank you. Now we have a compliment and a question. This presentation was beautiful. Would you be willing to share your slides as a handout? So what I would say is if participants are interested in, and if you are willing, if they contacted the North Idaho AHEC at uidaho.edu, we would be happy to help facilitate delivery of those slides.
Excellent. Yes, that is fine with me.
Another question, will there be access to your information such as the STOP technique?
I will. So what I can include along with the slides are the breakdowns of the STOP technique for you, and with more explanation. So yes, I can include the STOP technique.
Wonderful. This was a wonderful presentation. How can we access a recording of it for individuals who want to re-listen? At this time, there's not a plan for a broad scale posting of this, but we will certainly keep attendees notified of any changes in that status.
Thank you. Thank you. I'm so glad that you're enjoying it. And I think we're also having some sorts of what's the word I'm looking for, discussions about continuing doing webinars like this one.
Another question, can you elaborate on the P from the STOP skill?
Right, thank you. So the P is, so we've observed what's going on in our body, we've stopped ourselves, we've had some sort of stimulus, and then the P is proceeding. Like, what is the best way that I can proceed right now? And it may be different, but most of us find if we can, again, the hard part is stopping right after that stimulus happens. This is the hardest part of it, catching ourselves before we react and taking that breath, because when we do this, we can calm ourselves down and we can bring our brain almost more online, if you will, and then we can really ask ourselves, like, what do I need? What is a decent way to proceed that I'm going to like a lot better, instead of just a knee-jerk reaction? And sometimes our proceeding may be just not to react. It may be reacting in a way that sounds like, you know, I need some time to think about that, or I'll get back to you, or gosh, all I need to do right now is just to breathe and not react. So proceeding may look a lot simpler than we think.
Thank you. One other question. Do you have any guidance for someone who is seeking to mend a relationship that they have hurt through their mental issue due to COVID-19?
That's a hard one. Thank you for asking. I think the approach to that is a common humanity approach, and to first forgive ourselves on a certain level and show ourselves self-compassion, but also to approach the other individual in a way that's not judgmental, in a way that approaches with common humanity. Like, you both were dealing with things that the other probably knew so very little about, that even as closely as we know somebody, you know, a best friend, we still don't know everything about them. And so my advice would be to self-compassion first, approach given a common humanity kind of basis, and be non-judgmental. Like, we make up stories all the time in our heads about, we want to make ourselves right, but we also just make up stories about what the other person may be thinking, when it comes down to it, it's no matter what we can expect the outcome will be, it'll be different. And so that's what I would do. I hope that helps. And I hope that you're able to repair that friendship.
What advice would you have for someone who is over-identifying right now?
Whew. I might recommend a couple of things, because when you begin to over-identify, it's kind of hard to unhook that. So if you have a good friend, somebody that you can talk to run that by them, or you can also think about, if you can step outside yourself and imagine this person that you love, that you care deeply about, being in your situation. And what would you tell them? Or what advice would you give them? And what kind of support would you give them? But a lot of times that's hard to separate ourselves, or hard to disentangle from what we're feeling. So we're so identified with it that we can't step back. And yeah, so think about you as your best friend. And then what would you say to you?
Thank you, Dr. Holyoke. So I think we have time for one more question. Sometimes it can be very challenging to work in a facility or department that does not demonstrate compassion toward their mental health providers. And yet we still need to demonstrate compassion toward our patients, each other, and ourselves. Do you have recommendations on how to separate oneself from treatment from the above and still remain compassionate to ourselves? Or compassionate ourselves, sorry.
Right, that's, I understand that pretty well. Gosh, why do we have to end on such a hard one? My advice would be to look for pockets of functionality. If you can find one or two people to work with on building compassion skills, on practicing together, on just being open and vulnerable with one another, then that lack of support above you may not matter that much, because you're looking out to take care of yourself, because your self-care is your responsibility. And if you're not going to get the support from above, then look for it around you. Choose people carefully in a pocket of functionality that you can talk with, that you can be compassionate with.
Thank you so much. Thank you for the wonderful presentation and for taking the time to address these questions. And thank you to the audience for carving out this time to attend. We really value the investment that you've made in yourselves today. So this concludes our presentation. I'd like to wrap up just with one kind of final nod of appreciation for Dr. Holyoke, our presenter, and for North Idaho AHEC's partners in the state, the Southeast Idaho Area Health Education and the Southwest Idaho Area Health Education.